Welcome to the Everything Cancer podcast. This podcast is intended for survivors, those who love them, healthcare providers, and leaders of cancer support organizations. Our guests offer insight into the honest survivor experience, how challenges are met head-on, and where blessings are discovered. We cover effective self-advocacy on the bumpy road of cancer survivorship from the moment of diagnosis on. We talk about rekindling intimacy when cancer has changed your world. We are given behind the scenes insight into cancer care because understanding it better empowers you to advocate for yourself more effectively. We hear from leaders of cancer support organizations about their resources and how to access them or those like them. The Everything Cancer podcast welcomes survivors who would like to share their journey and how they have met their challenges, providers who would like to share their empowering insight, and leaders of cancer support organizations who would like to share their stories and resources. We welcome support through sponsors, the Everything Cancer website, and our Patreon page. Please note, the information shared on the Everything Cancer podcast is not intended as medical advice. Please always consult with your healthcare team. The staff at Everything Cancer podcast will not answer individual healthcare concern questions. Thank you for joining us, and we hope that you enjoy this episode and find it useful. Please do share it with other people if you think they'll benefit from it, and rate us on your favorite podcast platform. Thanks and take care. Hello, everybody. Welcome to the Everything Cancer podcast. We have a very knowledgeable and caring guest with us today, Rachael McCall. I'm going to go ahead and let her introduce herself. She can change your life for you. Rachael, go ahead.
Hi, I'm Rachael McCall. I'm a doctor of physical therapy, and I'm also a certified lymphedema therapist, as well as an oncology rehab specialist and a pelvic floor physical therapist on top of it. So I'm really excited to be here.
We're excited to have you. I plan on having you back many more times after today.
Awesome.
So we're here to talk today about pelvic floor physical therapy and how much it can improve a person's quality of life.
Yeah, definitely. I think pelvic floor physical therapy is something that's, I think we were chatting a little bit before, is something that's not utilized a lot for a lot of people, not just in the cancer realm, but with just anybody in general. People tend to deal with signs and symptoms of pelvic floor dysfunction and don't understand what that is. So I'm going to talk a little bit about what pelvic floor PT is and what the pelvic floor is, because I think a lot of people don't know, but we have this bowl of muscles that sits in the bottom of our pelvis, and they control starting and stopping urination, starting and stopping bowel movements, sexual function, and then supporting your pelvic organs, such as your uterus, rectum, bladder. And they are super, super important for everyday function. And signs and symptoms of dysfunction would be like urinary incontinence, bowel incontinence, constipation, sexual dysfunction, pain with intercourse, erectile dysfunction. All of that kind of stuff is what I see with patients very frequently. And in the cancer realm, we deal a lot with side effects from chemotherapies, radiations, surgeries that will impact this area for people. And they oftentimes have issues here that they just think, oh, well, this is just a part of life and I'm just going to deal with it now, but my life is saved. So we can just kind of deal with this. They're symptoms that really impact people's quality of life and don't realize that there's an answer out there for them.
Yes, and I completely agree. I have seen it make a tremendous difference for people. It does take investment on your patient's part and them being willing to do the exercises at home.
The internal environment, so we talk about this bowl of muscles in your pelvis. I always joke and say that they get a bad rap because they're muscles in a cave, but they're the same muscles that we have anywhere else. So we need to treat them as such. So when I look at a pelvic floor patient, what we're looking at is the internal environment. So we do internal assessments with a lot of our patients if they consent to that and they're comfortable with that. That gives me an idea of what is going on with the musculature inside of the pelvis and how is that impacting their symptoms and what do we need to improve upon with that. So we look at muscle tension, which tends to be a major issue for a lot of people. It's not just weakness. I think we live in a world where we're like Kegels, 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 but also, yeah, you can have a really strong pelvic floor, but that can also lead to tension as well. So we look at tension of the muscles. If they're tense, what do we do to get them to relax a little bit more? We look at the strength, the coordination, and range of motion of that muscle, and then we improve upon that. So that's one side of what I do. And then the other side is looking at the whole entire person. So I also look at the external environment as well, because these internal muscles interact with the external muscles. So when we have hip weakness or core weakness, that can really impact how these internal muscles are functioning on a regular
Mm-hmm.
basis. So it's not just the internal side of things. We also look at hip strength and core strength and flexibility, and look at you as a whole person and how we can improve upon that as well, which I think doubly is really important for cancer patients on top of it,
Mm-hmm.
because oftentimes they're a little bit more debilitated, have weaknesses that they just have developed over time from
Mm-hmm.
treatments, surgeries, radiation, all of that
Mm-hmm.
stuff. Um, so we look at both of those things, and then depending on what we find, we come up with a treatment plan for people moving forward. Oftentimes with pelvic floor physical therapy, we talk about lengthening the tissue, so getting the muscles to release and relax first, and then we focus on strengthening and then reincorporating that into everyday life. And typically for patients, that's about a 12-week process for most
Mm-hmm.
people. The reason we set it up as 12 weeks is because we know that it takes 12 weeks to make physical change in the muscle cells. So to get the muscle cells to hypertrophy, and that's what makes long-lasting change for people over time.
Oh, okay.
Yeah.
I did
So
not
it's
know
kind of,
that.
yeah, yeah. So it's based on the science, and I personally only see people once a week. I think that's usually enough to get people going. But if somebody needs more, we can absolutely do more than that.
Mm-hmm.
And everybody's a little bit different, but for the most part, that's around the range that we're looking at to see
Mm-hmm.
long-term change for people.
So, that this is so fascinating that you can make such changes. So someone listening can relate. Let's say you have someone coming to you with bowel incontinence. How would you deal with that person? Because that is something that keeps people from going out to dinner, makes them uncomfortable about going to work. It really affects their self-image. It can affect their sexuality and their intimate relations. To help people wrap their head around what you're talking about.
Yeah. So really getting to the patient's why, like why are they there to see me, is really
Mm-hmm.
important. So you're right. There's a psychosocial component to all of these
Mm-hmm.
things, and it can really impact everybody's daily life.
Mm-hmm.
So, we look at where in your life is this impacting you, and how do we make the biggest impact to decrease those symptoms. So a
Mm-hmm.
lot of my treatments are not just like, okay, here's 10 exercises that you're going to do, at this time of day. It's what are we doing throughout the day? Because these are
Mm-hmm.
functional things that you're just
Right.
experiencing throughout life. So yeah, just looking at that is super, super important, especially with bowel incontinence. I mean, we look at what you're eating. We look at how many bowel movements are you having a day? When are you having the leakage? Is it constant? Is it just smearing that you're having with after a bowel movement? And there's a lot of tips and tricks that we can give people to improve that. And then depending on what's going on the internal side of things, what do we need to do there to improve
Mm-hmm.
that?
So that's amazing. And so you work with them on the musculature and the nerves
Mm-hmm.
surrounding the bowel movements and
Mm-hmm.
teach them. You work with them to change the musculature in a way that would control those better, and also biofeedback with recognition of when do they need to relax or when do they need to apply more effort or something like that. And you look at the whole person to be able to change this thing that they probably thought they were just stuck with. And another thing is erectile dysfunction. How would you deal
Mm-hmm.
with someone? And I know everybody's not the same, but a general approach for erectile dysfunction. And typically, how much do you see it make a difference?
Yeah. Same thing, really. Like, when is this impacting you? What does this look like? Is there pain? Is it sometimes that you have issues, or is it all the time? And again, the musculature inside of the pelvis, like, what does that look like? And
Mm-hmm.
oftentimes I do see this improves. It's not something that I see a ton of currently, but I do see people come in for it. I think men tend to not go to pelvic floor physical
Yeah,
therapy as much as women do,
right,
because they don't realize that it can help them.
right,
So
right.
I generally see a lot more women than I do men, but I still do see quite a few men. So I think that just the same approach, like, how is this impacting you? Getting into the deeper issue of why this is bothering
Mm-hmm.
you.
Mm-hmm.
Obviously it's impacting your everyday life. Um, and same process, just examining everything in the whole body and seeing what we can do to
Mm-hmm.
improve that. So oftentimes, tension can be an issue there. We can decrease the tension, and that oftentimes improves things too. And teaching men specifically how to contract their pelvic floor and relax their pelvic floor, because I think that's generally something that women tend to sometimes know what to do with that, and they don't. So a lot of that kind of education goes into erectile dysfunction stuff.
That makes a lot of sense. And when you're talking about contracting and relaxing, you can also talk about the muscles lifting the penis better, but also
Yeah,
the blood filling better if
right.
you understand how to relax. And also, I'm sure with your work with them, you probably help them decrease performance anxiety because
Yes.
they are gaining more confidence in their body in working with you. And that in of itself can contribute to this greatly. And also just getting more comfortable with how their body works. So I think if you do a lot of reading about sexual therapy with people that are having issues, especially after cancer treatment, but anytime, talking about it and working around the problem and not realizing that you have to, or understanding you don't have to stay in the same on the same road you've always been on, that the road
Hmm.
can be a little different and your intimacy can be a little different, and work with what you have actually increases
Yeah.
intimate partner success a great deal. And I'm sure you're talking with them helps that so much.
Yes, yes. And I
Yes.
and the educational piece is such a huge piece of this, right? Like,
Hmm.
they're
Right.
muscles that a lot of people aren't aware of. And I think especially with intercourse issues a lot, and I see this a lot with women. It's like, oh, well, pain, it's just going to be painful. This is how it's supposed to be. I'm going to suffer through it. And it's like, no, you don't have to.
Right.
And there's things that we can do to improve that. So,
Right.
I think looking at that and diving into that educational piece
Hmm.
is so helpful for people, and they start to understand their body a lot better.
Right, right. So I'm so happy to hear you say all of this. And so let's segue into women, because there's a lot of
Mhm.
women who have issues with vaginal stenosis after radiation therapy, or vaginal pain, or discomfort after any surgery, any kind of treatment. If you can kind of enlighten us in how pelvic floor physical therapy can impact that quality of life perspective for women.
Yeah. Yeah. So same concept of like looking at all of these
Hmm.
tissues, but with vaginal stenosis specifically, the earlier you can get into pelvic
Yes.
floor physical therapy, the better. And I say this across the whole cancer spectrum, in that no matter what cancer you have or what you're dealing with, go see an oncology rehab specialist. Like, the minute you get diagnosed, the better it is, because it's going to improve your outcomes on so many bases.
Hmm.
But especially with gynecological cancers, the earlier we see you, the better outcomes you have, and we can
Hmm.
reduce the risk of that vaginal stenosis happening and treat you during those times
Hmm.
that it's the tissue is going to be most pliable, so the most difference that we can make in that tissue. So I highly encourage women to come see us as soon as possible.
Right.
But yeah, just getting that tissue to try to loosen up and getting it to
Hmm.
widen and getting things to
Hmm.
open up. So one of the things that we use a lot is dilators with those
Hmm.
individuals, and teaching them how to use those appropriately. I've seen many people just get dilators from their gynecologist. They're like, here, take them home. And I'm like, oh, let's teach them how to use them. So if we can teach them
Right.
appropriately how to use them and use relaxation techniques on top of that with some external stretching and mobility, that can really, really improve that. And then the pain part of it too is just learning how to insert something without having pain. So
Hmm.
like we can kind of retrain our brain in all of this and saying like, oh, I can insert a smaller dilator and it doesn't feel as bad. And it's just that confidence again, like, oh, okay, this is going to get better.
Hmm.
I can improve this.
Hmm.
Because when we're stuck in this pain cycle, I mean, pain is really complex. So
Yes.
when we're really stuck in this cycle, our body remembers, right? So if
Mm-hmm.
something's painful once, it's going to hold on to that tension. So if we're experiencing pain with intercourse or intimacy, then our body is going to just automatically tighten up. So we have
Mm-hmm.
to rewire that brain connection to the pelvic
Mm-hmm.
floor, which is super, super important part of that.
Yes, yes, it is. And you give them confidence to do that and understanding and how to do that. It sounds like common sense, but it's easier said than done for sure.
It is.
And for women, this isn't just gynecological cancers. This is anal cancer. This is rectal cancer. This is anything where the lower abdomen is impacted by treatment, whether it be surgery, radiation, and so on. There's so many things that can affect that vaginal pliability, along with menopause from treatment and menopause as you
Breast
grow older.
cancer.
Yes.
Mm-hmm.
And so Rachael can really help, and other people like her can really help. Rachael, can you tell us what the difference is for a oncology rehab specialist versus a physical therapist who's very good at their job but doesn't necessarily specialize in oncology rehabilitation? Thank you for tuning into the Everything Cancer podcast. We appreciate you being here with us. If you are finding this episode useful, please share it with others that you think would benefit. And don't forget to rate us with your favorite podcast platform. Please check out the show notes for more information and more information about our guests, links to their websites, and any other resources they've shared. We aim to make it easy for you to connect and learn more about the valuable insights shared in each episode. We welcome support through sponsors, the Everything Cancer website, and our Patreon page. Please stay tuned for a brief word from our sponsors, and then we'll be right back to our episode. Thank you so much. Do you have a dry mouth that distracts you with that nasty feeling and taste? H2 Ocean has your solution, literally and figuratively, with its sea salt healing rinse. It's made from salt from the Red Sea, and it has other minerals that are beneficial to you in it. It also has lysozyme enzyme, which is soothing to the inside of your mouth, and xylitol, which makes your mouth water. It's very mild in flavor, yet refreshing. Does not make you suck in your cheeks like often happens with other mouthwashes. And it stays with you. Other mouthwashes, they're gone in 10 or 15 minutes. This has stayed with me for a few hours now, and it's great. I plan on using it before every podcast episode to keep my mouth moist without taking distracting sips of tea and so on while I'm talking. The links to the H2 Ocean Sea Salt Healing Rinse will be in the show notes, and then a QR code also on the YouTube version of this podcast. It's excellent to help rinsing with chemo mouth or irritation in your mouth from radiation, but mouth sores and just general everyday use. I find it really pleasant and really helpful to use. I hope you do too. Thanks.
Yeah. So typically in PT school, we get about like a day of oncology or so.
Which is so much more vast than that.
It is, and it's very complex. So when I was in PT school, I remember I went up to one of my professors after the oncology lecture and I said, "Where do oncology PTs work?" And they were like, "I don't know." So that's what opened up this door for me. And I was like,
Yes.
I need to figure this out. And never in my life did I think that I would be doing what I'm doing today. But it's really about like impacting the people who don't
Yes.
get the treatment that they need, which is what I love. So there's oncology rehab specialists. There's a couple of different ways that people can become that. You can take a board certification, so they can be a board certified oncology rehab specialist. I'm not board certified yet. Eventually in my future, that's the goal. But there's also people who take just continuing education to be an oncology rehab
Mm-hmm.
specialist. So my training was with the PORI certification, so Physiologic Oncology Rehab Institute. So you can become a PORI certified oncology rehab specialist.
Mm-hmm.
So somebody might have that delineation. I think that there's not a ton of us out in the world, but
No, there's
I
not.
think just questions, when you're looking for a physical therapist, like, do you work with cancer patients on a regular basis? Oftentimes certified lymphedema therapists have a little bit more of a contact with those patients, so that's super helpful. But yeah, I think there's this huge gap between what we learn in school and the continuing education piece of it that you
Mm-hmm.
do on your own, which was, I was just like, I mean, oncology is not an easy thing. It's very
Right.
complicated, and everybody looks so different. You can have two patients with the same diagnosis who look incredibly different and have different paths. So, yeah, just I think asking the questions of, okay, have you worked with people like this before?
Mm-hmm.
Do you know anybody who has? I think that's a helpful
Mm-hmm.
piece.
So you tailor your treatment to a person's specific abilities and needs and what they have going on, their current state, and what their future goals are. That's
Yes.
phenomenal. I mean, I think most people in oncology do that, but it sounds like you really get into the nitty gritty with it. Um, so share with us some, without sharing patient information, some success stories that have really impacted you and made you feel really good about what you're doing. You find very rewarding.
I see so many success
Yes.
stories, which
Well, that's
is
great.
why why I do what I do.
Yeah.
I think for me, like the pain with intimacy, I don't know. There's just something about that just makes me feel so good that somebody can, have that relationship again with their partner, and that's like a huge piece of your life that people don't
Yes.
realize is missing.
Right.
So I see a lot of that.
Good.
And people end up having enjoyable intercourse again, which is awesome. Also, just any of the incontinence stuff, like you see it click for patients where they're like, oh my gosh, Rachel, I'm not leaking anymore. I didn't have any leakage this past week. And I'm like, yes, like it's such a win. Um,
Yes.
or like just noticing like something as simple as getting a squatty potty, right? Like, and having normal bowel movements where you don't have to push it out anymore. And people are like, oh my gosh, I can't believe that really helped that much. Those are the moments that really like just speak to me and make
Mm-hmm.
me love what I do even more. But
Mm-hmm.
I mean, there's hundreds of success stories that like I can't even count, but it's very humbling, and it's very, very rewarding to help people in these daily functions that we just kind of
Mm-hmm.
take for granted, I think, a lot
Yes.
of times. And a lot of people have issues here that they just don't even realize are a problem until they come in and see us, and they're like, oh my gosh, wait, I shouldn't be doing that, or that's not
Right.
normal. And
Right.
yeah.
What is a squatty potty? I can kind of envision it, but if you could enlighten me in the audience, that would be great.
Yes. So I am not sponsored at all by Squatty Potty, but
No, that's all right.
I love them. So it was actually a Shark Tank idea. It is a stool that just sits right in front of your toilet. So the idea is that we, like, from a evolutionary standpoint, we're supposed to poop by squatting, and
Okay.
oftentimes on our toilets our pelvic floor just isn't in a position that can be totally relaxed. So when we elevate our feet onto a surface and our knees are a little bit higher than our hips, it relaxes the pelvic floor, so bowel
Mm-hmm.
movements are a lot easier for people. And I swear by it. I think bowel movements are so much better with a squatty potty, so I highly recommend, even if you're not having pelvic floor issues, get a squatty potty. They're awesome. You could also just get a regular stool too and put it in front of the toilet. But that's like the number one thing I tell people when they come in. They're like, I feel like I'm trying to push out a bowel movement really hard, or I'm
Yeah.
straining, and it can really help.
I'm going to order one. It sounds like a really easy solution to a problem that can really cause us a lot of consternation. Um, so, people that are dealing with intimacy issues, that does affect a lot of things. It affects, whether or not you realize it does, it affects the dynamics between you and your intimate partner. It affects your self-image. It can affect then how you approach things at work, how you approach things with your family, because there's so many dynamics involved with that, with your intimate partner, that can really cause some inner reflection that isn't always positive. So dealing with intimacy issues can actually make a huge difference in quality of life for people, not just from the physical pleasure standpoint, but from the all around, how do I feel about myself standpoint, and my relationship with my partner. Um, and so people can't always expect to get back to where they were prior to their treatment, but they can learn through you and through other means how to adjust what's called their sexual script, the the road that they've been on typically to get from point A to point B might have to take some different turns, but that's okay, because the important part is having the intimate relationship that involves trust and communication. So your part in that is huge. And getting rid of pain is huge, because you're decreasing performance anxiety, you're decreasing pain, you are helping people understand what their current state is and where they can get, so that they have reasonable goals for themselves. I mean, that's amazing.
Yeah, I love it. And I wouldn't change it for the world. I mean, really,
Right.
you nailed it on the head. There's just so many things that change when you're going through cancer treatments or surgeries, or, whatever it is that you're
Mm-hmm.
dealing with. And I think it's really hard for patients when you're at the end of this journey, I see it with breast cancer patients a lot. It's like, oh my gosh, like everything is so different. Like, I'm
Yes.
thankful to be here. I'm thankful the cancer is at bay, but I like feeling comfortable in your skin again. And
Mm-hmm.
I think that that's so hard for people. And if I
Yes.
can give them a sliver of confidence and a sliver of normalcy again, that's what I want to do. And like you said, it may not be what it was beforehand. And a lot of my patients are okay with that. They'll look at me and
Right.
they'll say, I'm okay if it's like, just tell me. They're a lot of times they're like, just tell me if it's not going to be normal again. And a lot of with cancer stuff, it can be challenging because, like we talked
Right.
about before, there's so many different outcomes with different people, and some people react one way and some people
Mm-hmm.
react another way.
Mm-hmm.
So it's hard for me to say yes, for sure you're going to get back to what you were, but more of, I'm going to do my best to get you feeling better, whatever that looks like.
Right.
And
Right.
we might find that that's a new normal for you, but as long as it's better than when you came into me, that's what
Right.
I care about.
Right.
And adjusting those expectations for patients too, I think is really important.
It
But
is.
most of the time they come in and they're like, I know that it might not be normal again, but I need help with something.
Right. And just the improvement, but also working together with their partner on the improvement and having the
Yeah.
communication open. And I'm sure they learn a lot of that communication from you, what to say, what, and have more confidence in it. So you do so many things in addition to helping them with their muscle tone and their
Yes.
musculature. And you work very closely with people. So no wonder you find it so rewarding. So what would you say to what would you say to patients that are even considering a pelvic floor physical therapy referral, or hadn't until they listened to this? Well, how would you sell it?
Just do it. I'm very blunt and straightforward. I think if you could imagine your life looking one specific way, or you could imagine improving one thing, imagine that symptom being completely gone. That's why you should do it. I think there's some taboo around certain things with the pelvis, and I think we're getting to a place where we're talking about pelvic floor physical therapy a lot more, which I'm so thankful for.
Mm-hmm.
But it's you're never going to know if it's going to improve unless you try. So
Mm-hmm.
go out and try it, and I promise you, you will probably get some benefit from it.
That's what I've heard from everyone who has tried it is, I wish I hadn't
Yeah.
waited so long. Just go.
Yeah.
How does someone go about getting a referral to a pelvic floor physical therapist?
Yeah. So I'm lucky. I'm in Ohio, so we have a direct access. So you do not need a referral. You can just call the
Mm-hmm.
office, come in, and it's great. But you can get a referral from any provider. It could be an
Mm-hmm.
oncologist, it could be a PCP, it could be a radiation oncologist. I mean, it could be
Mm-hmm.
anybody. Just ask for it. And 9 times out of 10, they're not going to tell you no. They'll be like, oh, okay, yeah, sure, here. And then
Right.
you send that to the pelvic floor physical therapy office, and they'll get you set up with an appointment. But just ask for it.
And how would someone find a pelvic floor physical therapist?
Yeah, that's the tricky part. So I, I mean, depending on where you are, looking into the health system that's closest to you and seeing if they offer
Mm-hmm.
that. You can also, a lot of times it's advertised with certain physical therapy clinics. I would ask if they do internal assessments, because we do learn things about the pelvic floor in PT school, and some of the people will implement that into their treatment and say that they do pelvic floor. But I would say, do you do a comprehensive assessment of like internal and external? And then they'll be able to tell you a little bit more. But just asking, the American Physical Therapy Association is also a good resource for patients
Oh, okay,
of
good.
seeing like where physical therapists are. So that's also a really, really good resource for them as well.
Okay. And I'm sure that as a pelvic floor physical therapist, you specialize in making sure people are comfortable with, because none of us like internal exams,
Right.
but making sure they're comfortable and they understand why they're doing this. And it makes it, I'm sure, a lot easier for them then.
Yes, and I always tell my patients, I am not here to make you do anything. If you are uncomfortable with it, we do not have to do it. It's a piece of it. It's important and it gives me a lot of information. But if they aren't comfortable with it, we can work our way up to it. There's so many different options. So don't let that defer you if you're looking into a pelvic floor. But you're like, I don't know, I don't want to do that. Nobody really does. It's not fun
Right.
necessarily. But I promise it's probably not as bad as you expect it to be. And your therapist should make sure you're comfortable. You have a right to stop the exam at any time if you are uncomfortable. Because I also deal with a lot of like sexual assault trauma and things like that
Yeah.
too. So
Yeah.
just making sure that people have informed consent and knowing that they don't have to do anything, but I'm here to support them in the way that they need to. And we can work up to that if we want to.
I like how you say we can work up to that. It does, you're not saying I can't do my job without it. You're saying
Right.
we can get there. And so they have a
Mm-hmm.
chance to develop a trusting relationship with you
Yes.
and understand maybe as they work with you on things, the benefit of you having that assessment to work with them even more intensively to further their quality of life.
Yeah. And I've had patients who they straight up look at me, they're like, I'm not going to do it. And I said, okay. And we do really well and we still gain improvement by just
Mm-hmm.
doing external stuff too. Not everybody's like that, but there is opportunity to improve even without that side of it. So, yeah, just knowing that there's options and it does not have to look one specific way.
Thank you so much for enlightening us on that. That's huge, Rachel. Thank you very much. I think you probably decreased anxiety a great deal for many of our listeners
I'm
by
glad.
explaining that. By explaining
Yeah.
that. So, is there anything else about pelvic floor physical therapy that you would like, or oncology rehabilitation that you would like to share?
I think my biggest thing is just ask for the therapy. I especially in oncology rehab, it's the Commission on Cancer Standards that you should have access to a physical therapist. So definitely ask for it, even if it's not being given to you. Like somebody's not saying, "Hey, I think you need physical therapy." It doesn't matter if you're not dealing with any symptoms.
Mm-hmm.
Go reach out to a physical therapist and see them. Like I said before, I see people from the time of diagnosis all the way through their treatment. And it oftentimes decreases their side effects from treatments. It makes them feel better. And it doesn't have to be every week, just checking in with people and making sure and answering questions. I can't tell you how many times patients have come in and they're like, why did nobody tell me this before? And it's a
Right.
lot of information when you go in, you're
Right.
diagnosed and then they're like, okay, here, boom, 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 here's your treatment plan. And they can't cover everything. So I can kind of help bridge that gap with people and educate them on, okay, here's what's normal, here's what's not normal, and here's how we can keep your function going as we move through rehab. So the earlier the better. Get out there, see somebody, just get an assessment and get a baseline, and then continue throughout your rehab. And the other thing is that it's never too late. So with pelvic floor or oncology rehab, even if you're 20 years down the road, go see somebody for it. There's oftentimes things that we can do to help improve it. I think, especially as women age, we tend to just be like, oh, I'm just getting older. This is how it's gonna be, and it's not. And there's things that we can do to help you. So taking that opportunity to see somebody, it's just
Mm-hmm.
never too late to get the help you need.
I love that. It's never too late. That's great. That's a great way to wrap this up. Rachel,
Yes.
I so appreciate your time today, and I really look forward to having you back.
Yes. Thank you so much. I loved it.
Oh, great. Great. I'm so glad. I loved having you here, and I'm sure everybody listening did too.
Awesome.
Thank you for joining us on this episode of the Everything Cancer podcast. We hope you found the conversation as insightful and as inspiring as we did. Remember, all the details about our guest, including their contact information and links to resources they've shared on their websites, will be included in the show notes. If you've enjoyed this episode, please consider supporting us by visiting our website, checking out our Patreon page, or becoming a sponsor. Your support helps us to continue to bring you these important discussions. Don't forget to subscribe to the Everything Cancer podcast on your favorite platform and follow us on social media. Always remember, the information shared here is not intended as medical advice. For any personal health concerns, please consult with your healthcare team. Thank you so much for listening, and we look forward to having you back with us again next time. And for anybody that you have invited to join us, please reach out if you would like to be a sponsor. We would welcome you. Thank you.